Sach, how are you?
I'm good. How are you?
I'm also good. So, hi, my name is Samreen Kaur and I'm going to perform sterile wound dressing. Before starting the procedure, I want my friend to rotate 360 degree around the room. So, hi Sachrit. I have received doctor's order which say I have to change your sterile wound dressing. Do you feel comfortable with me?
Yes.
Okay, thank you. Let me provide privacy to my client. Okay, so Sachrit, can I see your band? What's your full name?
Sachrit Kaur,
And your date of birth?
24 October 1998.
Yes, that's right. It matches with my document. She is my right client. So Sachrit, now I'm going to provide you a comfortable position before starting the procedure. So I'm going to provide you armrest. Also, I'm using a draw sheet in case of soil dressing or to prevent any kind of drainage. Sachrit, on a pain rating scale from 0 to 10, 0 being no pain and 10 being worst pain, how would you rate your pain?
3.
Do you want any kind of medication to relieve pain?
No.
Okay. Lastly, I want to confirm, do you have any kind of allergy from any medication or food, anything?
No.
Okay, thank you so much. Now I will make my arrangement here. So I have to make sure to make a triangle with the tray, client and the garbage. So I will start with putting the garbage bin on the position. And we have to make sure once we make the sterile field, we never turn our back toward that. So I'm taking out the tape so I can use this at the end for the wound dressing, and I have to take the 4 steps. And the 5th one is for documentation of my initial and date for the another nurse for the confirmation. So I'm going to prepare my tray. Open it away from me on one side, on the other side, taking the forceps, turning the position. Okay. Maintaining 2.5 centimeter sterility, that is around 1 inch. Now, this is the sterile field. I can reposition it and take out the supplies. I have 2 metallic forceps and 2x2 and 4x4 gauze pieces. Maintaining sterility. I have to take out extra gauze pieces. So for that I'm using banana peel method to maintain sterility. I need 2 extra gauze pieces for that. And also taking out the Q-tip, putting it on the sterile sheet. So I'm going to wear my gloves. Now I'm going to open the bottle for normal saline and put it without touching the mouth with the tray. I've already documented the date of opening the normal saline. Now I'm going to assess her wound and remove the old dressing. Are you okay, Sachrit?
Yes.
Do you feel pain?
A little bit.
Okay. Upon looking on the dressing, I can find serosanguinous fluid, which has a little bit pus with that. So the location of my client wound is forearm. It is a closed wound which has 6 sutures on it. I can see a little bit of erythema around the suture, and now I will palpate for pain and edema. Do you feel any kind of pain?
A little bit.
Here?
Yeah.
Okay. Thank you. So there is a little bit of edema and pain present, but not much. So I'm going to remove my gloves, clean my hands, put on clean pair of gloves. So now I'm going to clean the wound, taking the forceps, dip it in normal saline, put on the sterile field, taking all the four corners, squeezing the extra normal saline. Now cleaning it on the distant side in one single stroke in a round manner. And discarding that, taking another gauze piece, putting it in normal saline, sterile field, squeezing the extra fluid, that is normal saline. So I'm cleaning the area which is closer to me in one single stroke. Going to take one more gauze piece, dipping it normal saline. While doing this, I have to take care that I perform this in head to toe manner on the midline in one single stroke. Now I'm going to pat dry, so I'm taking gauze piece, taking all the four corners and pat dry in the same manner, distance one. Another gauze piece, the closer side to me, discarding it. And now the midline in head to toe position. I'm putting it on the sterile field. Now I'm going to measure the length of the wound with the help of Q-tip without touching the wound. Measuring it with the help of scale. It is around 6 centimeters. Discarding it. So now I'm going to put the gauze piece to cover the dressing. Taping it. We have to make sure that we tape it in 4 sides but not at the mid of the suture. Do you feel okay?
Yes.
So I have secured the wound dressing. Now I'm going to put the last tape where I'm going to put my initial and date, so that other healthcare worker is well aware when and who change it. I'm going to remove my gloves. So Ms. Satreet, I'm going to take out this and put you in a comfortable position. Taking out the draw sheet, discarding it, taking out the armrest. As I have put her bed up, now I'm going to put her in a comfortable position. Do you feel okay?
Yes.
I'm going to take all the material from here and I'm going to put the call bell here in case you need anyone or you feel pain or any medication or any kind of help. Just ring the bell. We will be available for you.
Sure.
Okay, so now I'm going to document the reading and the assessment of my client. The suture was closed. It has been secured with 6 sutures on the lower forearm, which is the left arm basically. Also there was edema, a little bit of erythema and a little bit of pain, like a mild pain which my client felt on palpation. So now her dressing has been changed and I have documented that. And now I want my friend to rotate 360-degree around the room. Thank you so much.